All right, let's dive right into this explainer and unpack the massive structural changes currently rolling out across Australia's healthcare system. If you've been keeping tabs on the sector lately, you know the landscape is shifting under our feet. Literally, from sweeping federal budgets all the way down to very specific targeted clinical programs. We are seeing a huge concerted effort to boost accessibility, slash out-of-pocket costs, and ultimately catch life-threatening diseases way earlier. So today, we're going to connect the dots between high-level government policy and what that actually looks like on the ground for both patients and healthcare providers.
Now, to understand where the industry is heading today in 2026, we actually have to look back at the official 2025/2026 Strengthening Medicare budget initiatives from the Australian government. This was managed by the Department of Health and Aged Care and administered by Services Australia, and honestly, it laid the groundwork for some of the biggest structural changes to Medicare in recent memory. It wasn't just about throwing money at a problem, right? It was about fundamentally rewiring how services are billed, licensed, and delivered to everyday people.
Here is the roadmap for our explainer. 1. Strengthening Medicare in 2025. 2. Expanding MRI access. 3. National lung cancer screening. And 4. Imaging industry leadership shifts.
Okay, Section 1. Strengthening Medicare in 2025.
Let's kick things off with the big picture, making healthcare more affordable. The core philosophy here is pretty simple. Reduce financial barriers so folks don't put off getting the medical care they absolutely need. Take a second to think about this number. 15 million. That represents the additional people supported by the expanded bulk billing incentives that kicked in late last year, back in November 2025. Before that, bulk billing incentives were pretty narrowly targeted, mostly at kids under 16 and Commonwealth concession card holders. But this new measure blew the doors wide open, expanding eligibility to all Australians. That is a massive demographic shift, bringing 15 million more people into the fold for unreferred GP services.
And what's fascinating is the government's dual approach here. They didn't just ask doctors nicely to bulk bill more patients, they built the financial engine to actually make it viable for them. Enter the Bulk Billing Practice Incentive Program. This provides an additional payment valued at an extra 12.5% of the MBS benefits for GP non-referred attendances every quarter. But, and this is a big but, here's the catch. To get that sweet 12.5% bump, practices have to commit to bulk billing every single patient for every single service. It's a complete all-or-nothing commitment. The goal? To absolutely guarantee zero out-of-pocket costs for anyone walking into those participating clinics.
Moving right along to Section 2, expanding MRI access.
So, with the GP side of things shored up, policymakers set their sights on a massive bottleneck: diagnostic imaging. For years, getting an MRI in Australia was bogged down by a really strict licensing system that created all sorts of geographic and financial hurdles. The game changer happened in July 2025. We saw a total pivot away from strict equipment-based MRI licenses over to much more flexible, practice-based licenses. Basically, under the old rules, the license was literally tied to the physical machine. Under the new rules, any partial or ineligible MRIs at practices that already held a license instantly became fully Medicare eligible. Overnight, the capacity for fully rebated MRI scans absolutely skyrocketed.
To get the ball rolling, 3 specific hospitals got the green light right away on July 1, 2025 for immediate Medicare eligibility for their MRIs. We're talking Lakeview Private in Northwest, New South Wales, plus Bar One Health North in Geelong, and Sandringham Hospital down in Victoria. This wasn't random. It was highly targeted to immediately boost access and affordability for patients living in those specific regional and suburban corridors.
So how does this actually play out over time? Well, it's a phased rollout. We kicked off with the practice-based licenses in July 2025. Then, the massive bulk billing expansion hit in November 2025. But the real wild card, the absolute game changer, is still on the horizon. Subject to legislation passing, starting July 1, 2027, the requirement for MRI equipment to have a Commonwealth license will be completely scrapped. Gone. After that date, existing and new MRIs become fully Medicare eligible, completely opening up the entire market.
Thank you for watching. Please like and subscribe to our channel.
Which brings us to Section 3, National Lung Cancer Screening.
Now, we really have to talk about why clearing these imaging bottlenecks matters so much in the real world. Let's look at a life-saving clinical pathway utilizing this new capacity, because the statistics are, frankly, sobering. Lung cancer is Australia's #1 cancer killer. It literally claims more lives than breast and prostate cancers combined. Why? Because most people are diagnosed way too late when curative treatment is off the table. The overall 5-year survival rate is just 26%, and it gets even more devastating when you look at the inequity. For Aboriginal and Torres Strait Islander peoples, that 5-year survival rate plummets to a heartbreaking 11%. This is driven by incredibly complex health determinants, things like geography, socioeconomic status, and systemic barriers to culturally safe care.
To tackle these grim numbers head-on, the National Lung Cancer Screening Program was created. The whole strategy here is proactive. Target high-risk folks before they show a single symptom suggestive of lung cancer. It's simple, really. Catch it early, and treatments like surgery or radiation actually have a fighting chance to work, drastically improving survival rates and quality of life.
The patient pathway itself is super structured, and crucially, it doesn't cost the participant a dime. Step 1, identify who is eligible. The program hones in on people aged 50 to 70 with a history of smoking tobacco cigarettes. Step 2, a referral for a free low-dose CT scan. And they're making this accessible. You can go to a fixed radiology clinic or even use mobile screening units out in rural areas. Step 3 is all about the follow-up. Unless they spot an abnormality, participants are put on a schedule for a new monitoring scan every 2 years.
Behind the scenes, for the medical pros running this, it's a very tight ship. It uses dedicated MBS items, 57410 for the 2-yearly scan, 57413 for interval scans, and bulk billing is absolutely mandatory for both. The reporting is also highly standardized. They use risk assessment tools like the PanCan nodule malignancy calculator for the baseline scans and the LungRad system for the interval ones. This ensures that whether you're getting scanned in a remote mobile unit or a massive city hospital, the clinical next steps, whether to come back in 2 years, get a shorter interval scan, or get an immediate referral, are totally consistent. All those results then get fed directly into the National Cancer Screening Register to track the whole journey.
And finally, Section 4, Imaging Industry Leadership Shifts.
Let's pivot and look at the corporate side of the equation. I mean, think about it. How does a company handle a massive influx of government funding, the impending total deregulation of MRI licenses, and the rollout of nationwide screening programs? It requires a huge strategic pivot. Take Integral Diagnostics, or IDX. They're a massive player in medical imaging across Australasia, operating exactly where all these policy changes are colliding. With way more patients eligible for bulk billing and a skyrocketing demand for low-dose CTs and MRIs, a company like IDX has to be positioned perfectly to absorb the volume without letting clinical excellence slip.
To navigate this, they are shaking things up at the top. Their recent press release from March 2026 confirmed a major executive shift to guide them through this whole transformation. Jason Martinez has been tapped as the new managing director and CEO. He officially takes the reins on August 6, 2026, after finishing up an extended transition or garden leave from his last job. And to make sure nothing falls through the cracks during this crazy period of growth, the current CEO, Dr. Ian Katish, is staying on board until Martinez steps in. It's a very clear signal to the market. You need a steady hand at the wheel when the regulatory rules of the road are changing this fast.
All right, taking all of this in, I want to leave you with something to chew on. As we watch these diagnostic licenses totally vanish in 2027, as nationwide screening programs start actively hunting for diseases before symptoms even show up, and as massive corporate leaders realign their entire strategies, what is the landscape of early disease detection actually going to look like by the end of the decade? We are watching a live shift from a reactive healthcare model to a highly proactive one. Thank you so much for joining me to unpack this explainer, and definitely keep an eye on how these big policies continue to reshape everyday practice.